Hello, my name is Dr. Daniel Martinez, Medical Director for Pilsen Wellness Center. I'm a psychiatrist and I've been working at Pilsen for many years. Today's presentation is going to be on major depressive disorder. Before we talk about that, I'd like to mention sadness, which is a very common and normal and natural condition. In fact, sadness is one of four basic emotions: joy, sorrow, fear, and anger. We all get sad very commonly, and we get sad when we have a perceived loss. Perceived losses are things like when I have a loved one that dies. You can consider grief as something that's tolerable for 1 to 2 months, but when it goes beyond that, a person really is having difficulty regrouping and getting back into their ordinary life. That's a loss. When a person is having so much debt, where their financial difficulties are getting them into tons and tons of trouble, that is a problem that can really catapult a person to have a biological, where there's a neurochemical imbalance, where a person really needs some professional help. When the sadness becomes more of a problem, where individuals have impaired functioning, the sadness may lead to a medical condition which is called major depressive disorder, where the sadness is accompanied by signs and symptoms like problems with sleep, problems with energy, problems with interest, guilt, appetite problems, issues with motivation, and then worst of all, suicidal thoughts. We really need to consider seeing professionals if these occur. But some people ask me, when do you think that I need to see a medical professional? Well, you need to see a medical professional when there are issues with functioning, when individuals have social or occupational functioning, when I can't function at work, I can't function at school, when my loved ones are noticing difficulties in my behavior or my motivation. That's when we might need help. Before diagnosing a psychiatric condition of major depressive disorder, we first need to be very careful in ruling out other issues such as biological problems. So things like anemias, infections, thyroid problems, drugs or alcohol, tumors, all of these things can cause the signs and symptoms of major depressive disorder. So making sure that we rule this out through the help of a primary care doctor is essentially and critically important. Psychological depression is implied in the name that it should resolve without the need for medications. When a person has what we consider an organic or a biological depression, really the person's body starts to shut down and the brain starts to shut down. And so the person really can't get out of their rut unless they really have an intervention that can help them through. It is said that even a biological depression can resolve itself in several months, but can you imagine several months of not going to work or not going to school? Your whole life is falling apart by then. A psychological depression is usually an adjustment disorder when individuals have difficulty with things that are going on in their lives, whereas a biological depression is a depression where a person really has neurovegetative symptoms, things like problems with sleep, problems with concentration, problems with energy, and problems with appetite and suicidality. That's when it gets very serious and you really need the help of a medical doctor. At Pilsen Wellness Center, we provide all of these services, and we do our best in making sure that we address all aspects of the individual. In previous slides, I've talked about the biological aspects of the individual, the psychological, the social, the cultural, and the spiritual issues that are very important in trying to address any emotional or psychiatric condition.